Diphtheria. Diphtheria, diphtheria, is a genuine bacterial contamination that normally influences the mucous layers of your nose and throat. Diphtheria is very uncommon in the United States and other created nations, on account of broad inoculation against the infection. Diphtheria can be treated with prescriptions. However, in cutting-edge stages, diphtheria can harm your heart, kidneys and sensory system. Indeed, even with treatment, diphtheria can be dangerous, particularly in kids. Manifestations. Diphtheria signs and manifestations ordinarily start 2 to 5 days after an individual gets tainted and may include a thick, dim film covering your throat and tonsils, an irritated throat and dryness, swollen organs, expanded lymph hubs in your neck, trouble breathing or quick relaxing, nasal release, fever and chills, discomfort. In certain individuals, disease with diphtheria causing microscopic organisms causes just a gentle sickness, or no conspicuous signs and side effects by any stretch of the imagination. Tainted individuals who stay ignorant of their sickness are known as transporters of diphtheria, since they can spread the disease without being wiped out themselves. Skin, cutaneous diphtheria. A second sort of diphtheria can influence the skin, causing agony, redness and expanding like other bacterial skin contaminations. Ulcers covered by a dark film likewise might be skin diphtheria. Despite the fact that it's more normal in heat and humidities, diphtheria on the skin likewise happens in the United States, especially among individuals with helpless cleanliness who live in jam-packed conditions. When to see a specialist? Call your family specialist quickly in the event that you or your youngster has been presented to somebody with diphtheria. In case you're uncertain about whether your youngster has been immunized against diphtheria, plan an arrangement. Ensure your own inoculations are current. Causes. Diphtheria is brought about by the bacterium Corynebacterium diphtheriae. The bacterium generally increases on or close to the outside of the throat. C. Diphtheriae spreads by means of airborne beads. At the point when a tainted individual's sniffle or hack delivers a fog of defiled beads, individuals close by may breathe in C. diphtheriae. Diphtheria spreads effectively along these lines, particularly in packed conditions. Sullied individual or family things. Individuals infrequently get diphtheria from taking care of a tainted individual's things, for example, utilized tissues or hand towels, that might be sullied with the microscopic organisms. You can likewise move diphtheria-causing microorganisms by contacting a tainted injury. Individuals who have been contaminated by the diphtheria microorganisms and who haven't been dealt with can taint individuals who haven't had the diphtheria antibody, regardless of whether they don't show any indications. Risk factors. Individuals who are at expanded danger of contracting diphtheria include kids and grown-ups who don't have modern immunizations, individuals living in swarmed or unsanitary conditions, any individual who goes to a space where diphtheria diseases are more normal. Diphtheria once in a while happens in the United States and Western Europe, where kids have been immunized against the condition for quite a long time. Nonetheless, diphtheria is as yet regular in agricultural nations where inoculation rates are low. In regions where diphtheria immunization is standard, the illness is basically a danger to unvaccinated or deficiently inoculated individuals who travel globally or have contact with individuals from less created nations. Confusions. Left untreated, diphtheria can prompt breathing issues. Diphtheria causing microscopic organisms may deliver a poison. This poison harms tissue in the quick space of disease, generally, the nose and throat. At that site, the disease delivers an intense, dim-shaded film made out of dead cells, microbes and different substances. This film can impede relaxing. Heart harm. The diphtheria poison may spread through your circulation system and harm different tissues in your body, for example, your heart muscle, causing such confusions as aggravation of the heart muscle, myocarditis. Heart harm from myocarditis might be slight or extreme. To say the least, myocarditis can prompt congestive cardiovascular breakdown and unexpected passing. Nerve harm. The poison can likewise cause nerve harm. Ordinary targets are nerves to the throat, where helpless nerve conduction may cause trouble gulping. Nerves to the arms and legs likewise may get aroused, causing muscle shortcoming. In the event that the diphtheria poison harms the nerves that help control muscles utilized in breathing, these muscles may get deadened. By then, you may require mechanical help to relax. With treatment, a great many people with diphtheria endure these inconveniences, yet recuperation is frequently lethargic. Diphtheria is deadly 5% to 10% of the time, as indicated by the World Health Organization. Cases of death are higher in kids. Counteraction. Before anti-infection agents were accessible, diphtheria was a typical sickness in small kids. Today, the illness isn't just treatable yet, in addition preventable with an antibody. The diphtheria antibody is normally joined with immunizations for lockjaw and challenging hack, pertussis. The 3-in-1 immunization is known as the diphtheria, lockjaw and pertussis antibody. The most recent adaptation of this immunization is known as the DTaP antibody for youngsters and the TDAP immunization for teenagers and grown-ups. The diphtheria, lockjaw and pertussis antibody is one of the youth inoculations that specialists in the United States suggest during early stages. Inoculation comprises of a progression of 5 shots, regularly controlled in the arm or thigh, given to youngsters at these ages. 2 months. 4 months. A half year. 15 to year and a half. 4 to 6 years. The diphtheria immunization is powerful at forestalling diphtheria. Be that as it may, there might be some results. A few kids may encounter a gentle fever, fastidiousness, laziness or delicacy at the infusion site after a DTaP shot. Ask your primary care physician how you can help your youngster to limit or diminish these impacts. Seldom, the DTaP immunization causes genuine yet treatable complexities in a youngster, like an unfavorably susceptible response, hives or a rash creates not long after the infusion. A few kids, for example, those with epilepsy or another sensory system condition, may not be possibility for the DTaP immunization. Supporter shots. After the underlying arrangement of inoculations in youth, you need sponsor shots of the diphtheria immunization to assist you with keeping up your insusceptibility. That is on the grounds that invulnerability to diphtheria blurs with time. Kids who got the entirety of the suggested vaccinations before age 7 ought to get their first promoter shot at around age 11 or 12. The following promoter shot is suggested 10 years after the fact, at that point rehashed at 10-year spans. Promoter shots are especially significant on the off chance that you travel to a space where diphtheria is normal. The diphtheria supporter is joined with the lockjaw sponsor, the lockjaw diphtheria TD immunization. This blend immunization is given by infusion, as a rule into the arm or thigh. TDAP is a consolidated lockjaw, diphtheria and acellular pertussis, challenging hack, immunization. It's a one-time elective immunization for young people ages 11 through 18 and grown-ups who haven't recently had a TDAP sponsor. It's likewise suggested once during pregnancy, paying little heed to past immunizations. Converse with your PCP about immunizations and sponsor shots in case you're uncertain of your inoculation status. TDAP likewise might be suggested as a component of the TD arrangement for youngsters ages 7 through 10 who aren't fully informed regarding the immunization plan.